Hi, this is Monica speaking, and welcome to our presentation on health stigma and discrimination in Canada. In the following slides, we are going to explore the objectives of different health promoting documents and how they align with the current Canadian healthcare system. Based on public health reports, Canadians are considered a healthy population. However, there are reports of stigma and discrimination in healthcare. For example, there are reports that healthcare professionals use disrespectful language towards HIV patients, ignoring them and preventing them from getting appropriate and safe information that protects their health and well-being. Also, due to discrimination towards First Nation people, they avoid hospital visits, therefore their health worsens, resulting in serious infections, diabetes complications, and depression. Based on the Lalonde report, human biology, environment, lifestyle, and healthcare organizations are determinants of health. To better understand this, we came up with the 5Ps acronym that stands for promoting health, preventative care, preventing stigma, people's first, and protect. To promote health, we need to consider other social determinants of health like education on lifestyle behavior, accepting more responsibility and reflection on human values, focus on needs of community, be more inclusive, and provide proper food, housing, access to health care, and to safe water. The Alma Ata Declaration is based on principles of economic and social needs of citizens and the provision of support to smaller communities. In this slide, you can see reports of discrimination experienced by different ethnic groups. The Lalonde report and the Alma Ata Declaration encourages a more inclusive healthcare system, examination of assumptions, and the adaptation of a more collaborative approach.
Okay, so for our next slide here, we're going to be focusing on the F report, which is a report founded in 1986 with the intentions for health promotion and reducing inequities between low-income groups. So this report focused on not criticizing or blaming the victim based on their lifestyle choices that they make, increasing the need for prevention, an increased need for more broad determinants of health, and looking at situations, again, more broad rather than individual. So we're going to be focusing on it as a whole community rather than the choices that that individual person makes. As you can see on the left side here, we have some infographics here, which represent self-care, a healthy environment, and mutual aid, because that is also what the EP report focuses on if that's needed. The EP report is also based on a socioeconomic and environmental determinants of health, which means that the government would need to support those in the community to engage in health promotion activities. So this can be relevant when we're looking at issues like HIV and other sexually transmitted infections. So rather than focusing on an individual's condition itself, the EP report focuses on a community and how we can implement health promotion and prevention. All right, so moving on now to the Ottawa Charter for Health Promotion, which is a conference that broadens on the Lalonde and the EP report, but also adds more health prerequisites into it. So for an example, they add more education for topics like HIV and sexually transmitted infections, which helps ensure a healthier quality of life. It also focuses on 5 health promotion activities, which are building a healthy public policy, creating supportive environments, strengthening community actions, developing personal skills, and reorienting health services.
Hello, this is Cassandra speaking. The Jakarta Declaration considers the many prerequisites of health, such as shelter, food, social justice, respect for human rights, social security, education, and empowerment of women. The main theme of our executive summary discusses how stigma and discrimination is correlated with poor health outcomes and lower quality health care. The Jakarta Declaration focuses on health promotion in a broad sense, meaning it prioritizes intervention that will benefit as many individuals as possible. This aligns with our executive summary by creating policies and promoting the many prerequisites needed to ensure equity amongst all individuals regardless of their gender, ethnicity, and physical appearance.
The Bangkok Charter for Health Promotion places a strong focus on creating a healthier world through globalized efforts and policy changes to remove health gaps and inequalities amongst developed and developing nations. In addition, it emphasizes the environmental factors such as global warming and severe weather and its impact on our health. The Address and Stigma Executive Summary recognizes the negative health outcomes of stigma and discrimination and focuses on the changes needed to remove the negative impact and to create health equality. The Bangkok Charter for Health Promotion aligns with the executive summary by working to create and implement policy changes to remove the health gaps and inequalities globally, therefore creating a healthier population regardless of their background.
Hi, my name is Sophia. I will be presenting the Canada Health Act as well as give a brief summary of the presentation. The Canada Health Act is a federal legislation that puts in place conditions by which individuals, provinces, and territories in Canada may receive funding for healthcare services. The main aim is to protect, promote, and restore the physical and mental well-being of residents of Canada and to facilitate reasonable access to health services without financial or other barriers. The Health Canada Act does align with our theme of stigma and discrimination in that the five main principles of the Act, the universality, portability, accessibility, comprehensiveness, and public administration. By universality, it means that all insured residents are entitled to the same level of health care. By being portable, it means that a resident that moves to a different province or territory is still entitled to the same coverage. Being accessible means that all insured persons have reasonable access to healthcare facilities. Being comprehensive means that all necessary health services must be insured. That includes dentists and physicians. Public administration means that all administration of provincial health insurance must be covered by public authority on a non-for-profit basis. In summary, the various definitions of health helped Canadians improve the healthcare system. By using the various models of care and addressing health based on individual needs, we can eliminate stigma and discrimination. This marks the end of our presentation. Thank you.